So I actually talk about the fact that it's counterproductive to keep giving and giving and giving and not being able to receive anything in return. And you don't have to receive it from the same people, but somewhere in the ecosystem, you need to be taken care of as well.
Hello, hi Shalata. Thank you so much for joining me today.
Thank you so much for having me.
Let's start by you introducing yourself. If you could just share a bit about yourself and your role in IHH. What are your responsibilities within the organization?
Sure. So I'm the Group Head of Learning and Development, but I also support the sustainability agenda, and for our people that means looking after their well-being and also diversity, equity and inclusion. So these are my three portfolios.
As a multinational company, how has IHH been managing staff well-being, especially since the onset of the pandemic?
We are, after all, a company of institutional caregivers. That's literally in our DNA. So day in and day out, our entire workforce across all of the countries that we're operating in is basically looking after other people. And therefore, one of the very important things that they need to do for themselves is also to look after their own well-being. And that's an aspect that is very often missed out. So as an HR profession, then it is incumbent upon us to look after the well-being of our own people who are looking after the well-being of others.
Awesome. And what kind of support system have you in place for your people?
So really, it runs the spectrum of some of the things that Intellect does as well, starting from preventative care, a social aspect of well-being, right down to crisis management, because we do know that there is a certain degree of trauma that is experienced simply because of the nature of the work and the roles that they're involved in. We have put in place some solutions, or we have strengthened them specifically because of COVID. But to be honest, they've been more on the crisis management side. Now we're seriously taking a look at how can we build in and bring long-term well-being solutions, and those are much more on the preventative side.
So Intellect recently conducted a study with Milieu Insight amongst HR professionals in Singapore, and we surveyed 150 HR professionals, and we found that the burnout risk is very, very high amongst HR professionals. 41% shared with us that they feel burned out at least once a week, and I think 75% of them at least once a month. So clearly HR professionals are also struggling, and I wonder what you are doing and your team is doing to tap into external resources perhaps, or internal resources to support your team.
So firstly, that metric surprises me. I thought it would be higher. So if we just speak to my fellow colleagues, people in the network, across different industries, anecdotal evidence shows that a lot of HR people at varying levels, I'm not just saying at a leadership level or at a transactional level, just across up and down the chain of command, have really struggled because they have carried, I would say, a disproportionate burden and load of supporting employees on the ground. Right? They've not just had to revamp their processes, but they've literally have to, if I can use that word, hold space for other employees that they're supporting in the organization. So not just from a process perspective, but really from a human perspective. And therefore, that's why I say I don't think that figure really surprises me. The tragedy is this. I think people who need the most support think about supporting themselves the least. So we've really started by talking about creating awareness for saying that it's okay for HR professionals to ask for help. We are sometimes seen as the solution providers, and therefore psychologically are not equipped to get into a space where we're not seen as the experts, and then we need to go and ask for help. So we do start by normalizing that conversation, and then by guiding to appropriate resources. And there we really follow what I call the cafeteria approach. People have different kinds of needs at different points of times, right? Sometimes you just need to talk to a friend. So we need to ensure that we're okay with having conversations around, I would say, the locker room or the coffee table, where it's okay to talk about how you're doing, or sometimes even to just ask the question, are you okay? Right? right up to the very professional level of support, which is either chemical-based, medical-based, or with professional mental health professionals. We do have the advantage of offering some of this in-house. We are, after all, a healthcare company, but we do use external providers where it's required.
Makes a lot of sense, right? HR is holding the space, you connect your employees with the resources, right? But you need to take care of yourself too.
Absolutely.
Otherwise, you guys burn out, and we've just looked at the figures. The risk is very high.
Yes.
But what we know really matters for burnout is the work culture. So if overtime is glamorized and managers expect that emails get answered outside work hours or over the weekend, people burn out. So I'm curious to hear how you support your HR managers to create a nurturing, a caring culture that does away with those glamorization of productivity and so on, and really focus on thriving and well-being and resilience.
I think there is a very important role that the microculture in a team plays. We tend to talk about culture as this large amorphous thing that sits at a global 65,000 employee helicopter level. But it's really the daily working environment, the shift working environment, the interactions with your team, and you're very right, the interactions with the manager that really play a big role in how an employee feels, how they behave, what is the levels of stress they experience specifically, what are the levels of de-stressing that happen as a result of those interactions or those conversations. You need to have hard programs and processes and systems in place to support, but you also need to have the heart of the matter, the fact that speaking about mental well-being is essentially you're coming from a place of vulnerability and a perceived lack of safety. Right? And unless both of them are in place, you have the need but not the solution, or you have the solution but not the articulated need. And so they need to kind of go hand in hand.
Especially psychological safety is quite widely used at the moment. It's a bit of a buzzword, but nevertheless super important. So how do we create workplaces that are psychologically safe, in the sense that staff feel safe to share how they really feel and reach out for help if they need it?
One of the things that we have noticed is that it is a journey. So although it is very tempting to put a solution in place, which is a training program, say, on psychological safety, or creating an organization which is fearless, I think it is about education of both line managers but also employees. It is the dance that happens between a manager creating the psychological safe space, but an employee stepping into that safe space. Right? Have we got there yet? No. Do we realize that it is a journey? Yes. Are we putting in mechanisms in place through awareness and training and learning sessions which are experience-based? I think that's kind of the journey that we're on. Right? It is early days for us. It's just been, I think, 18 or 19 months since we've consciously embarked on this journey. So let's see where we go.
In summary, what I heard is that there's a huge responsibility on the managers to create a safe workplace. So they need to be upskilled in terms of mental health literacy. They need to walk the talk. They need to really make it okay not to be okay, and provide the resources and really help employees to reach out when they need help. But I also heard that there is a responsibility on the individual, on the employee, to build that sense of agency, to develop various self-care strategies. There's no one-size-fits-all solution. For some employees, it's going out to nature to take a walk. For others, it's to do a meditation exercise. For others, it's about challenging their negative thoughts. So really, what works best for the individual, but we all have a responsibility to make good choices and do what's best for our mental health, to put the oxygen mask on first before I can support others.
Completely, and I think I'll add just one more dimension to highlight. I think the organization's responsibility in this state of play is really, this is how the workforce of the future needs to be managed. This is how an organization of the future needs to be led. So we need to provide the resources, we need to provide the focus, the attention, and really ensure that the well-being and sustainability agenda is interwoven into the way we all do business.
Awesome. Are there any final thoughts, Shailaja, you want to share?
I think I'll just end on the note, it's okay to be not okay.
Thank you so much for being here today and
Thank you
sharing
so much.
your journey and what IHH is doing. Absolutely wonderful.
Thank you so much for having me.